I'm Dr. Amrinder Bajaj. I have done my MD in obstetric and gynecology from All India Institute of Medical Sciences. My areas of interest are like minimal invasive surgeries, high-risk pregnancy, and of course, menopause, even adolescent health. I'm very keenly interested in that also. Menopause is a retrospective diagnosis. See, you've not had your period for 3 months, and you have it on the 4th month. So you're not having menopause. It's only if you've stopped having period for a full year do we tell that the woman has had menopause, has attained menopause. But in that period also she will start having symptoms of menopause because her ovarian function is decreasing. The estrogen hormones and progesterone hormones are decreasing. So that is, she'll know only after 12 months of not having her periods. There are 2-3 ways. The best way is to a woman can have menopause is that it comes late, the quantity decreases, the time duration decreases, and then over a period of a year or so, it stops completely. Okay. There are some who stop suddenly, and then they don't have it at all. Those are the exceptions, not the rule. Usually this is the way: delayed periods, scanty periods, and then gradually it stops. Because the estrogen and ovaries are packing up, they stop producing estrogen and progesterone. Okay. These female sex hormones. Okay. Heavy periods and quick earlier periods may not be, there could be hormonal disturbances also, but there could be symptoms of other diseases also. It could be due to menopause, but those need to be investigated. Perimenopause is when she's still menstruating, but the ovarian function has started to decline. So then she'll have these menstrual delays and irregularities and maybe some menopausal symptoms. Menopause is the 12-month period during which after which we will know that she's had menopause. And the rest of her life, she's in the postmenopausal phase. Bleeding after menopause is absolutely not acceptable. For some women, the transition is very smooth. They wonder what is all this fuss about. Nothing. Some people have mild symptoms which are manageable just by lifestyle changes. And some have really issues, big issues. There are very few really have issues that most of which can be addressed. So the symptoms that usually disturb them are these hot flashes and cold sweats. Suddenly, if we are in the middle of a talk or a meeting or something, because at that time they are the heads of some corporates or something and all that, and they suddenly feel so hot and suddenly feel cold sweats, and it's embarrassing in front of the other. Then there's a vaginal dryness that leads to painful intercourse. That is a very treatable condition. They again feel shy to come कि इस उम्र में भी करना है क्या, क्यों नहीं करना? That is different. I mean, the doctor or somebody will say कि अभी तक भी इसको interest है. It is good to maintain interest. It's good for your well-being state if they do have that interest. Then thirdly is then they have these other joint mood swings. They suddenly feel those are the things that keep on adding. And what are lots of the symptoms of menopause, but most of them don't have any of them. The urinary complaints, stress, they can't hold the urine. Bathroom जाते जाते they थोड़ा सा निकल जाता है, और coughing and sneezing में भी urine निकल जाता है. So these are also symptoms.
Subscribe to the YouTube channel and don't forget to hit the bell icon so that you don't miss any videos by us.